I'm Whitney Dean. You're listening to Talk to the Experts on News Talk 770. And when it comes to your heart and heart disease, we hear a lot about it, but we don't hear a lot about when it comes to prevention or really learning about it and what we can do either before something happens when it comes to a heart attack or getting heart disease, or even afterwards as well. So someone who really knows when it comes to heart disease, what it's all about, can explain it to you, and the options that you have right here in Calgary is Diamond Fernandez. He's director of HeartFit. You can find them heartfit.ca. That's heartfit.ca. And he joins us. Good afternoon, Diamond.
Good afternoon.
Okay, so first of all, there's some staggering stats when it comes to heart disease that I think for a lot of people, we know that heart disease is serious, but they're quite staggering.
Yeah, it's, obviously with heart disease, it is the number one cause of death of men and women. And of course, it'll combine all the cancers, it'll get more women as well, including breast cancer. And I know a lot of the media is out there in terms of cancer. I'm not trying to dismiss that aspect of it. But not only is it the number one cause of hospitalization and death, it's also the number one preventable disease. Yeah. And so at the HeartFit Clinic, what we focus on is really doing some great screening tests that are not available at your doctor's office. And more importantly, some treatments options that are available that are very evidence-based and proven to be able to effectively reverse the disease process.
Okay, so there's a few things that you've said that are huge. Reversing is a big one because I don't think people really know about that. But then also let's get into the testing part of it. Because I think for a lot of people, they think, well, I get my blood pressure done every year and it says it's fine. Or if there's some issues or I'm worried, I'll just get my cholesterol done and, things will be fine.
Yeah, so why don't I navigate you through heart disease, or our listeners through heart disease? So when you go see your family doctor, they're a very important hub in your healthcare system. And if you haven't seen one or have seen one, it's really when we open up the toolbox of a family doctor and we want to know what your risk is of a heart attack or stroke, they can check your cholesterol, right? We know there's 3 different types of cholesterol. We hear about the good, the bad, and ugly, I call it. So there's that option. It's important for your doctor to check your blood pressure and to check your risk of diabetes. That is all that they can do to see where your risk is. And they can plug those numbers into a score, what we call Framingham Heart Score. People might have heard of that before. Maybe some physicians are listening to that. It was a study that was done a long time ago, and it is somewhat effective. But the concern with that is we're still having heart attacks and strokes. And even if you determine someone's at risk or not at risk, the majority of people who end up in the hospital with a heart attack, they've had a normal, they could be normal or moderate scores, which usually gets dismissed from that perspective. And there was a trial that just came out. There's these some people have heard of cholesterol lowering drugs. And many times if your cholesterol's high, and I'll get into this part of it a little bit later. But if your cholesterol's high, we just say, okay, well, let's give you a cholesterol lowering pill. And now there's these new injectable drugs where we can inject, every 2 weeks, a little injection into your body, and it will lower your cholesterol. I think the research shows 74% now. We can take someone's bad cholesterol and reduce it to 74%, which is huge, which now eliminates cholesterol as being a risk factor to heart disease. But here's my concern with it. In spite of getting it down that low, we're not seeing the same changes in outcomes. So there's still that population that are still having heart attacks and strokes in spite of lowering their cholesterol by that much.
And the other scary part that I would say is that these are all people who've probably had know they have heart disease, angina, have had something happen. But there's a lot of people who have who are at risk who don't even know that they have anything going on with them.
Of course. And that's what we focus on at the HeartFit Clinic, is we focus on doing some strategies to reverse that process and go more in depth than what you can do at your family doctor. So going to your family doctor is a good start, but it's kind of, if you open up their toolbox, there's not much that they can do to see where you're at, even if they gave you the best drug in the world to lower your cholesterol. Fair enough. If you go to a cardiologist, let's say they refer you to a cardiologist, and we open up their toolbox to see what your risk is of a heart attack or stroke, there is only one test that we can do on a non-invasive basis that we've been doing for many years, and that's the stress test. And the stress test has been the golden standard as to what we can do to see non-invasively what your risk is of a heart attack or stroke.
And that's the one where you're running on a treadmill for a
You
set
go on
amount
a
of time?
treadmill for a while. When looking at your ECG, while that is important, I don't like the outcomes from either that option. Either one, you're going to see the best cardiologist in the world. They're going to do a stress test with you. And I'm talking specifically for coronary artery disease. Now, there are other types of heart disease that we can get into that we can focus on helping people at the HeartFit Clinic. That's what we can focus on. But going to a cardiologist and getting just a stress test done, in my opinion, is also a waste of time because it's almost like a coin flip there. We're telling people, look, you don't have heart disease, so go on, everything's okay. Or we're going on for further diagnostics, which I also don't think is okay. Mm-hmm. So, and I'll explain that. So when we look at a stress test, if we think about looking inside our arteries, a stress test will only show advanced stages of a disease. Mm-hmm. So an artery's got to be about 80% blocked before it starts to show up on a stress test. So we walk you on a treadmill and we see what's going on. So here's the problem with that part of it. The majority, and it's the big stat I really want some listeners to understand, and what we focus on in the HeartFit Clinic is to get to the bottom of this aspect of it. The majority of heart attacks and strokes actually occur with blockages that are less than 50%.
Mm-hmm. And that's the scary stat.
Yeah.
When you always bring that up, that is the scary part of the stat. Because I think for a lot of people, even if they've had some type of heart event, they will get some testing done. Maybe they feel like the 80% blockage or 90% or 100% blockage, that was the one that caused the problem. They might have a few blockages that are 40, 50%. They think, oh, well, those ones are just fine. Yeah. But you're telling us that it's not.
No, and okay, so let me explain that. So at the HeartFit Clinic, we have a test to see what your risk is of a heart attack or stroke in the next 5 years. It's called the Pulse Cardiac Test. Mm-hmm. Now, up until earlier this year, you only can get that in the States. Now, we're the only ones in all of Alberta, I think maybe even all in Western Canada, that has this test.
So it's the Pulse Cardiac Test.
And so we can determine what your risk is of a heart attack or stroke in the next 5 years.
That's huge.
Which is way more important. It gives people peace of mind, or what can I do? And we give people those options on either end, right? So let me explain. Let's go back to that part where I was talking about the majority of heart attacks and strokes occur with blockages that are less than 50%. Mm-hmm. So firstly, your arteries are not a pipe. They are a muscle. Heart disease does not happen like our kitchen sink at home when it clogs up. It doesn't happen the same way. We all think of this analogy that cholesterol sticks to the artery wall until it accumulates to you're at 95%, and as soon as it goes to that extra 5%, boom, you have a heart attack. Mm-hmm. It's furthest from the truth. That very rarely happens. And people are going to be like, well, what does happen? Mm-hmm. Again, your arteries are not a pipe, they are a muscle.
Do you have that written in your house somewhere in the clinic?
Well, can
your kids recite that?
It irritates me.
Yeah.
I've been doing this for, a long time. Since the late 90s, I've been in this cardiac rehab discipline. And of course, I used to drink the conventional Kool-Aid in terms of what that is, but cardiologists are not plumbers.
Yeah.
And I hear that analogy all the time, and they even call themselves, well, I've fixed your plumbing. And that's such a wrong way of saying that, because your arteries, like I said. So let's talk about a blockage.
Yeah.
So let's think of that blockage like a pimple on our skin. I have one here today. And so there are two things that can happen with that pimple. And that's what we focus on in the HeartFit Clinic, is to look at what's at that risk. So if we look inside the arterial wall and we look at a pimple, that's like a plaque inside our artery. Mm-hmm. A plaque builds from the inside out of an artery. It doesn't happen from the outside in. Does that make sense?
Yeah.
So if we take it back onto this pimple you're looking at here today, we're not on TV, so it's okay. There's two things that can happen to that pimple, right? Either the skin can be nice and strong and it'll hold that pimple in place, mm-hmm. right? Just like that plaque inside your artery, the skin is nice and strong protecting that plaque. It's got to hold in place somehow, otherwise it'll just flop around in your bloodstream, right?
Yeah.
So it's got to be held in place. Or the other option, which I think I'm close to having, is is the skin can be vulnerable.
Yeah.
And that pimple can explode, and not to get disgusting here, but it can bleed. All the pus can come out. Now, here's where, imagine that pimple inside your artery, and it's, let's say, 30% blocked or 40% blockage inside your artery.
Yeah.
We look at that pimple, and if that pimple's ready to explode inside our artery, all the pus, all the bleeding will happen at that site, and that is a heart attack or stroke. That can happen in days or hours, and that is a heart attack or stroke. That's why the majority of heart attacks occur with blockages that are less than 50%. It's a vulnerable skin holding that plaque in place that explodes. So at the HeartFit Clinic, one of the best tests that we have to see where your risk is a pulse cardiac test. And that test we're the only ones in I believe all of Western Canada. I could be wrong in saying that, but definitely all of Alberta, to see where your risk is of a heart attack or stroke in the next 5 years.
And that test has been around a while. It's just that people used to have to fly other places to get it done.
Absolutely, yeah.
Yeah, and so it's totally proven. Okay, I want to learn more about the pulse cardiac test, how it works, because I understand it's not invasive, because people hear testing sometimes and they get a little nervous, so we'll get in that.
Yeah.
I know you're ready to jump on that just in a moment. And then I want to learn more about external counter pulsation therapy. So that's where the reversing part comes in as well. So we'll get into that in just a moment.
Perfect.
Talking to Diamond Fernandez, director of the HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. Back in a moment. News Talk 770. I'm Whitney Dean, and you're listening to HeartFit on Talk to the Experts on News Talk 770, the HeartFit Clinic. You can find them heartfit.ca. That's heartfit.ca. You can also call them to book an appointment, 403-870-4348. That's 403-870-4348, or 1-877-700-4348. That's 1-877-700-4348. The director of the HeartFit Clinic is in, Diamond Fernandez. Okay, Diamond, we were learning a bit about heart disease, how it happens, how it's not just about your arteries are not a pipe, it's a muscle.
Yeah.
And we'll drive that point home again, I'm sure.
Yeah.
And some of the different testing in the beginning phases of the pulse cardiac test. So whether you have heart disease already or you don't know if you have heart disease or there's problems.
Yeah.
So the pulse cardiac test, offered here in Canada. You don't have to fly anywhere for it anymore, which people used to have to do. First of all, what happens when you come into your clinic and you're asking for this test? How does this test work?
So no doctor referrals required to come into our clinic. So, and it's important, I think, anyone who has had their cholesterol done or wants to know where their risk is of a heart attack or stroke, the pulse cardiac test will, one, either give you peace of mind, or two, I can let you know, look, you're heading down this path or this trajectory that is not so good. I can tell you, look, there's an accident on the way home. Make sure you go a different way.
Yeah.
And that's the loving thing I love to do at the HeartFit Clinic. We have so much fun reversing this process. It's cool. It's, if someone's on this path, then we can reverse it, right?
Yeah.
And so that's the big focus. And people who then, for those listeners who have had a heart stent or bypass surgery, we got excellent treatments available to see where you're at, of course, from that perspective too.
I do want to bring up, so for stents, a lot of people think when they've had heart disease, had some type of heart event, a heart attack, that, I got a stent, so it's fixed.
Yeah, no. And I would just be blunt with it.
Yeah.
Look, cardiologists, there are different types of cardiologists. And again, there are different types of heart diseases. When we're specifically talking about coronary artery disease, there's a lot more that you can do than just getting a heart stent or bypass and you're all good to go. While those are important, and there's a time and place when someone should be getting a heart stent.
In an emergency situation.
Absolutely. Let's go down this path, actually.
Okay.
So before the break, we talked about, look, you had a stress test, it's a clean bill of health, or look, we're going on for onwards testing. Now you've come down this, we'll call it we're looking for the prevention side of things, right? So you're coming down this path of seeing your family doctor, or you maybe had gone into the hospital with chest pain and they've sent you back to your family doctor. Now you go get this testing done and you either got a clean bill of health, which is, again, wrong. I don't like giving people a clean bill of health. There's more that you can do, and that's what we focus at the HeartFit Clinic, like the pulse cardiac test to see where your risk is of a heart attack or stroke in the next 5 years. If you're going onwards for other testing, we're looking at a nuclear stress test, and then finding yourself to an angiogram. Now, an angiogram, while it's a really great test to get done and it tells you what's going on inside the vessels of your heart, if you're coming down that umbrella and they say, look, well, we need to do a heart stent or bypass surgery, I don't necessarily agree with that option because there are a lot more things that you can do before you can go to that option. Does that make sense? And so you're coming from a prevention arm and you're parking your car and you're all the time and like, honey, I'm just going to park the car and I'm going to get this angiogram done. And it should never be done on a what we call with stable heart disease. That should never be done that way. Now, if you're having a heart attack, we have one of the best centers in all of probably the world. If you're having a heart attack, we want to get you to an angiogram as quick as possible to get that heart stent in. And that's where the best application of it is, or bypass surgery if we can't get to it. So if you're having an emergency, we have probably one of the best centers in all of Calgary, and of course all of Calgary, but all of Canada in terms of treating that vessel. If you're coming from the prevention arm, I don't think you should go down that route. And I got enough research to back me up on that part of it. And, interventional cardiologists are very good at what they do, which are the ones that are doing the stents and doing the angiograms. They're really good at what they do. But when we're talking about a stable vessel, let's go back to our pimple analogy, right? So imagine that pimple being like that plaque on your face. If we go in and disrupt a stable pimple, now that pimple is going to explode or cause an inflammatory marker inside your arteries or there's
you're irritating it.
Yeah, you're irritating the skin, right? Remember, your arteries are
a muscle, not a pipe.
There you go. And so when you look at that part of it, I don't agree intervening on a stable side of things. That's all. Yeah. And instead of that, that's where we have external counterpulsation at the HeartFit Clinic. For those people who have coronary artery disease, external counterpulsation is, in my opinion, and even those people who have heart failure at a certain level. So if you have heart failure or coronary artery disease or diabetes with circulation issues, we have the best treatment available to help you with heart health, and that's called external counterpulsation.
So that's for a lot of people, not all, but a lot of people, the next step after getting that pulse cardiac test.
It could be. Or for those people who already know they have cardiovascular disease, right? And so now they're sitting there like, okay, well, I'm listening to my doctor. I'm taking all my medications. You're taking a cocktail, probably 4 or 5 medications. And then, they kind of say, look, maybe you should exercise. That's important. But that's what I talk about in my book that's being released anytime soon now. So that part of it is, okay, that's an important step. But to take it to the next level, external counterpulsation is one of my favorite treatments to help people truly get healthier with their artery health. It does 3 things. It actually does a lot more than 3 things, but 3 things specific to your heart health. 1 is improves heart function. 2, it improves artery function. And 3, it increases, it's a process called angiogenesis, which grows new arteries.
Ooh.
Yeah. So if someone has cardiovascular disease, and at the end of the day, it's all about blood flow. How well are we giving blood flow to the heart muscle itself? And if you're being compromised, even let's say, I don't know, let's say you have a blockage that is 30 or 40 or 50%, whatever, it doesn't matter. But the artery is not functioning well at that site. Agreed? So your artery should be like a garden hose that you bought from, Canadian Tire that's fresh and elastic and moving well, right? It's delivering that water or that blood from an artery perspective out to the heart. So at the HeartFit Clinic, what we focus on is getting your arteries to like a brand new garden hose rather than being something that you left out all winter long.
Yes.
It's still delivering flow and it gurgles a little bit, but we don't want that aspect of it. So that's the best explanation I can say from that.
So what is it like to do external counterpulsation? Because some people get a little nervous about medical things and tests. So
of
what
course,
does that look
it's
like?
100% non-invasive. It's non-surgical. We've had hundreds of people do it here in Calgary. And the best part about it is it's safe. There's no bad things that can happen. And of course, our nurses are the ones that do the treatment with you. And it's a completely safe treatment to do with cardiovascular disease. Of course, we do a very thorough assessment, make sure that you're a good candidate for doing this treatment. There are some small things that we make sure of, but predominantly it's once you pass that part of it, it's 100% safe. So what happens during this treatment, it's actually, it's a covered treatment in the States right now. So it's been covered for, I don't know, 15 years, maybe more. And so a lot of patients would fly down to the States to get this treatment. I know a lot of people that from Alberta have flown down there. So now you don't.
Because it's valued as a prevention or a reversing method.
Yeah, it's a very evidence treatment to do those three things: improve artery function, improve heart function, and improve blood flow, and increase angiogenesis, which is growing new arteries. So a lot of people have to fly down there, and it's covered down there in the States. Of course, Canadians are not covered down there. So people don't have to do that anymore. And with this treatment, so basically what happens is you have these cuffs that go in your calves, your thighs, and your buttocks, and it sequentially inflates, and it pumps blood basically back to the heart. So that's the counter pulsation aspect of it. And so it's timed to your cardiac cycle. Patients lie in a bed here, and they lie in the bed for an hour. And some patients can sleep, some patients relax, whatever.
I know, in everyone's busy day, I think an hour of silence is nice.
And we give a lot of education on there. I mean, we focus a lot on our 3 E's at the clinic, which is external counterpulsation, exercise, and cardiac education. And with cardiac education, we're talking a lot about nutrition, supplements, what stress management, what are things that you can do that are specific, because not everyone has heart disease for the same reasons. And we can't just treat everyone with the same cocktail that we do coming out of the hospital. It's got to be individualized. And that's what we do at the HeartFit Clinic.
So then after how long do people have to go through the external counterpulsation therapy? How does that work?
So we usually do 2 months of treatments, and it's a daily treatment that happens when patients do that. So, and
then you're meeting with them throughout the entire process.
Yeah. So that's the beauty about the HeartFit Clinic. We focus on a personalized and individualized approach to your heart health. That's what we do. Yeah.
Okay. I know that we've talked a lot about when it comes to heart attacks, but in angina, like, does that fall? What is angina? Like, how does that fall into all of this?
So, and at the HeartFit Clinic, we focus on a little bit more better strategies on angina. So a lot of people can have angina for various reasons. They've got blockages that are not amenable to a stent or bypass, or they have a stent that is closing up, or they have a bypass graft that is closing up. Right? So those are the 3 reasons why people end up with angina. Now, there's some other reasons that can happen as well. I won't get into that part of it, but of course you can contact us at the HeartFit Clinic to go through that in more detail. But when we look at angina, that is where patients experience some kind of discomfort that is related to the heart. So that could be shortness of breath. It could be chest pain. It could be shoulder pain, back pain, teeth pain, jaw pain, neck pain, or just fatigue. People just feel like I'm slowed down. I'm not able to do what I normally do. And that could be a form of angina for people, is fatigue. And so at the HeartFit Clinic, if you have that, so either you've been diagnosed with cardiovascular disease, or you do our testing to see if you are at increased risk of a heart attack or stroke. And if you are, or you do have cardiovascular disease, then that's where external counterpulsation can be your best treatment to help you with that.
And you don't have to fly anywhere to go get it, which is what people used to have to do. It is right here in Calgary. We're going to learn more from Diamond Fernandez, director of the HeartFit Clinic. Website, heartfit.ca. That's heartfit.ca. You can also call them 403-870-4348. That's 403-870-4348, or 1-877-700-4348. And I want to mention that he does have his book that's coming out. So it's Beating Heart Disease, if you're looking for that as well. More with Diamond Fernandez, just a moment with HeartFit on Talk to the Experts on News Talk 770. I'm Whitney Dean. You're listening to Talk to the Experts News Talk 770, and we're with the HeartFit Clinic. And I think a lot of people know that heart disease is the number one killer or number one cause of hospitalization. We've talked about that a bit as well, but I want to get into some of the cholesterol stuff here, because a lot of people associate heart disease with cholesterol. In studio, Diamond Fernandez, director of the HeartFit Clinic. You can find their website, heartfit.ca. That's heartfit.ca. You can also phone them 403-870-4348. That's 403-870-4348. 4348. Okay, so Diamond, when we think of, as I said, heart disease, it's all about your cholesterol, what you're eating with your cholesterol, your natural cholesterol levels, all the bad cholesterol, good cholesterol, everything. But then you threw this stat at me during the break, which is kind of scary when you think about it. So 50% of heart attacks and strokes occur with people with normal cholesterol. What is happening there?
Yeah. So, like I said, let's talk from the prevention arm, and I'm going to also talk from then the people that do have cardiovascular disease. So the listeners that will fall into those two categories. A lot of times people will be prescribed a cholesterol-lowering pill to prevent cholesterol from happening, prevent a heart attack or whatnot. But the fact is that many people will wait, and it's not so they just don't know. Now you don't have to wait to have a heart attack or stroke. You can get the pulse cardiac test at our clinic, at the HeartFit Clinic. Yeah. And so for those people who saw their family doctor and said, look, we're going to give you a cholesterol-lowering pill because your cholesterol is high, there's something that is very important. I want our listeners to go onto Google, and obviously Google's got some great information and not so great information. But the point is that if you know how to search it properly, or you can call us, of course, the HeartFit Clinic, is understanding what the number needed to treat is on a preventative basis. And I don't like those odds. They're not, I mean, your odds are worse. You got a better chance of going to the casino and winning on roulette. Yeah. Which I think you can pick 1 out of 38 numbers, I think it is. So, and that's not good. So what I mean by that is numbers needed to treat are really high. And I'm going to explain that to the listeners is that let's say we take 100 people, and let's say the number needed to treat is 100. And that means we got to take 100 people. Let's say you do not have heart disease and you have high cholesterol. We got to take 100 Whitneys to go into the doctor's office for one person to benefit. Wow. So the number needed to treat is really high with patients on a preventative level. And so it's more than just cholesterol. So let me explain a simple test that we do at the HeartFit Clinic as well, is we look at particle size. So the best way I can say that, imagine the artery is protected by a tennis net. Okay. So, and we look at bad cholesterol, right? We all know that there's good, bad, and ugly. We got a lot of solutions to help lower LDL cholesterol, which is the loser, the bad cholesterol, but not all of it's that bad. So LDL comes in 2 different sizes, actually more, but let's, for this argument's sake, have 2 different sizes, tennis balls and golf balls. Okay. So you got these tennis balls and golf balls floating around your bloodstream. And if it's protected, the artery is protected by a tennis net, tennis balls will not go through a tennis net, but the golf balls will. Yeah. I'm going to get a little technical here. This will be as technical as I'll get today. Hopefully not more, but the golf balls are what we call atherogenic. Okay. Atherogenic is basically particles in your blood that can cause atherosclerosis, which is plaque buildup. So the best way I can say it, the small particles, the golf balls, are the ones that can cause plaque. Now, when you go to your doctor's office and you determine what your cholesterol is, they're looking at the tennis balls and golf balls together. What we do,
so they see it all as the same thing.
All the same thing. At the HeartFit Clinic, we focus on what is the breakdown of it. What is the tennis balls you have? What are the golf balls you have? And that's an important test to understand, because the majority of heart attacks and strokes actually occur with people with normal cholesterol profiles. They would have passed that Framingham heart score that doctors put into the system. I think it's automatically calculated at Calgary Lab Services now when you get your, we see what your risk is of a heart attack or stroke. Well, that's a joke. And I'll flat out say it's a joke, because there's a lot more that we can do now. And while that's a good starting point for people, it's not, well, here you are, you got a X% risk of a heart attack or stroke in the next 10 years, I think is the Framingham score. Well, now we got something a little bit better to tell you what your risk is of a heart attack or stroke in the next 5 years. And it's accurate, it's very proven, it's evidence-based, and we're the only clinic that does it, at the HeartFit Clinic. now here in Calgary.
So what I'm getting is that they're treating all of those balls the same way, and so you're not getting that accurate assessment as to at where you're actually at when it comes to that. So you could be put on things that you don't need, or you could not be doing things that you need to be doing.
And then there's also numbers needed to harm on medications as well. Now, I'm a big fan of medications. I may sound like we're 100% against medication. If someone does have a problem, we'll try and fix it. Of course, it's important. But if you have a problem, we fix it. But if it's cholesterol, I think we're focusing on the wrong thing. That's my big point here. Now, like I said, I think when I started earlier today, at the HeartFit Clinic, we focus on more detail.
Yeah.
You can now get these injectable cholesterol drugs that will lower your cholesterol a ridiculous amounts. We almost take cholesterol out of the equation. Then why are we still having heart attacks and strokes? That would be my question. Just look at things critically as to that aspect. So there's more that we can look at, and that's what we focus on in the HeartFit Clinic. We focus on how can we reduce the inflammation of that pimple or that plaque inside your artery.
Do you find it interesting that when people come in to see you, I think a lot of times when someone has had either a family member or themselves experience some type of medical event like a heart attack or heart disease or stroke, something like that, where they think they're educated because they've listened to their doctor and they read all the paperwork they got. Do you find that you have to spend a lot of time actually teaching them about this stuff too? And they're surprised about it?
Yeah. And some doctors get it, and we get a lot of referrals from those doctors because they understand that part of it. But some doctors are maybe stubborn, or they're just used to doing what they're always doing, or they're doctors are very smart people. However, sometimes they're just focused on one aspect of it, and they fail to look at what else is available. And where the what else is available. Right. If you want to know what your risk is of a heart attack or stroke, the HeartFit Clinic is a solution for you.
And that's that pulse cardiac test.
Yeah, and there's other testing that we can do, but the pulse cardiac test is a great test to see where your risk is of a heart attack or stroke. We're going to give you either peace of mind, or we're going to tell you, look, there's some things that we got to do to prevent and reverse this disease process. For those people that do have cardiovascular disease, that have had a heart stent, a bypass surgery, have angina, pains, heart failure, we got now solutions, diabetes. I'll even throw diabetes in there because 4 out of 5 diabetics end up with cardiovascular disease. The whole aspect of it is now we have treatments available along with all our education and processes to be able to reverse that process, to make sure it doesn't go. Because people the lifespan of a heart stent. I mean, you can Google that. How long does a heart stent last? And unfortunately, there's a failure rate on the stents. Obviously, it's a lot within the first year, but then afterwards we can have restenosis, which is the plaque starts to build up inside. All we've done with a heart stent is push the plaque out to the side. The vessel still has cardiovascular disease. It doesn't just go away. It seems like
an emergency measure to be done. Like that's what it is.
We don't have liquid Drano that we can give to our muscle to just clean it out, right? It's not a pipe, right?
But you do help those people with those stents keep those muscles healthy when it comes to the arteries with that ECP.
Absolutely. And everything else that we talk about. Yeah.
Hey, we're going to talk more with Diamond Fernandez, HeartFit Clinic. Heartfit.ca is the website, heartfit.ca. You can also phone them 403-870-4348. That's 403-870-4348 or 1-877-700-4348. Also, you can find the book Beating Heart Disease. Author is Diamond Fernandez. So more with him just a moment on HeartFit on Talk to the Experts on News Talk 770. Learning about your heart on Talk to the Experts in your heart health with HeartFit Clinic, and you can find them heartfit.ca. That's heartfit.ca. They are right here in Calgary. You can phone them 403-870-4348. That's 403-870-4348 or 1-877-700-4348. Director of the HeartFit Clinic, Diamond Fernandez, is here, and he's also the author of Beating Heart Disease. You can find that as well. Okay, Diamond, so listening to the program, you piqued my interest on, what is happening with my heart? Should I go get tested? Should my husband go get tested? All that stuff. Well, why don't I just go to my family doctor or, even say I need a referral to a cardiologist because I think something serious is going on?
Yeah, so at the HeartFit Clinic, we don't require a referral to come into our clinic, although we do get some referrals from cardiologists and doctors that understand our
I know
processes.
about you, yeah.
Exactly. And so at the HeartFit Clinic, we focus a lot more detail. So I think I talked about how when you go see your family doctor, they can check your cholesterol, they can check your blood pressure, they can check to see if you have diabetes. I think they can even do an ECG, which is just a one-time 6-second snapshot of your heart, which is a waste of time, in my opinion, because there's more testing that we can. If you're looking for a cardiovascular disease, there's a lot more you can do than just that. And so when you look at that from that perspective, family doctor doesn't have that much in their toolbox. And so the ones that understand that part of it, and for those family doctors that might be listening, at the HeartFit Clinic, what we focus on is a great test to see where your risk is of a heart attack or stroke in the next 5 years. And so we talked about how the majority of heart attacks and strokes actually occur with blockages that are less than 50%. And so if you're fortunate, I'm going to be saying this, if you're fortunate, you'll get a warning sign of cardiovascular disease before it actually happens. And that's in the form of angina. But if we're looking to see where your risk is and you don't have that angina, or you might have some chest pains once in a while, I woke up with something and I had my heart fluttering or whatever it might be, that's what we focus on in the HeartFit Clinic. So going to a cardiologist, while they are important because there are lots of different forms of heart disease, when we look at coronary artery disease, we talked about the stress test. And the exercise stress test, everyone's heard about it before. You walk on a treadmill and walk to max, and we see what's going on. And we either give you one or two options. Either you say, okay, we've got a clean bill of health, or we're going to go onwards for more testing. And I don't like either options from a preventative side of things. So that's where the HeartFit Clinic can come into play after that part of it. And so we talked about the stress test, how it will only show advanced stages of a disease. So it's, in my opinion, wrong for a cardiologist to say, they should say, based on this test, we don't see you at risk of a heart attack or stroke. While it is still possible, please make sure you follow some recommendations from your doctor. Make sure we keep all your generic risk factors under control. What would be even better if they said, look, go to the HeartFit Clinic. There's a test that you can see where your risk is of a heart attack or stroke in the next 5 years. So we don't see anything that is at risk at this time, but here's another option for you. And then if you're going for onwards testing, I don't like it. And there's a time and place for that. Don't get me wrong. But for the most part, I don't like it because it involves some radiation now. It involves radioactive dye that goes inside of you. And if you've had that test or are about to go for that test or whatever it might be, you might still be on that path. But I don't like that part of it because, again, it falls into that umbrella. Okay, we don't see any problems, or you're going to an angiogram to see now right inside your arteries of your heart. And you should never go to an angiogram, in my opinion, on a preventative basis because we can already see where you are a risk if you have blockages on the thallium or the nuclear stress test or the MIB scan. Those are myocardial perfusion imaging. Those are all similar terminologies from that part of it. And there's a trial called the COURAGE trial that shows that these are people with stable cardiovascular disease. And if we give them a heart stent versus doing medical therapy alone, we're going to say have the same outcomes, right? And so that's where ECP therapy at the HeartFit Clinic might be a better option for those people. And even for those people who already have diagnosed cardiovascular disease or come at risk on one of our tests, is now we have ECP therapy, exercise, and education. Those are the 3 E's. And education comes in the form of understanding what to eat, a lot more than just our food guide. That's what we focus on. Key supplements that you should be having to prevent and reverse heart disease, and stress management. So, yeah.
And with that ECP, I think for Canadians, it feels like something new, but it's not new around the world. And that's why it's so important that people know that you can come into Calgary now to do it. People used to have to fly out. You would have to come into Calgary now. And it is FDA approved for all of these things.
Yeah. And so, and it's my favorite treatment. So we have our clinic in South Calgary here. And so it's so much fun to see the changes in people. It really is, because after the treatments, people have more energy, more, like I said, you got 3 things that happen that are really huge to heart health. And there are a lot more other side benefits that happen. You basically get improved artery function. You get improved heart function for those people who are in heart failure or have poor heart function. And then you have the process of angiogenesis, which is growing new arteries. Yeah.
Okay, what are the side benefits then?
Oh, there's so much. I mean, I got this, I don't know if it's on our website, but if you email me or anything like that, there's like geez, I have a picture that's got about 20 different pointers that helps with everything from
Yeah.
that. It increases blood flow. So, and this is something that our listeners might have as well as with erectile dysfunction. You know, erectile dysfunction, we just kind of close our eyes and turn to the side about it and say, okay, well, you know, maybe I am over a certain age and I'm not able to get an erection as easily or whatever it might be. And those are important things that can happen. But the arteries going to our sexual organs are a lot smaller than the ones going to our heart. And so if that's actually quite a big marker for heart disease.
It's funny because people think it's just age. I'm just going to leave it alone, whatever. It
No.
just doesn't matter. But it does.
Yeah. And so sometimes we talk to our family doctor and say, look, you know, I'm having some problems here. And they prescribe a medication that will give you a solution to that. And that's actually a big marker to then maybe we should look at what your heart attack risk is here because it's very much linked. And so, I mean, that's obviously
Is that one of the side benefits?
Side benefits, of course. And so, anyway, I had a couple come into my office. It was quite a little funny story just this week here. So they were talking about that part of it too. But I mean, we give people's lives back when you increase energy, increase thinking, and
the peace of mind
peace
part
of
as
mind
well.
part of it, of course, is just improve blood flow. And when you improve blood flow, you help kidney function, you help, so many different things in your body. So
I would also think the pulse cardiac test and then the external counterpulsation, it also it gives people a sense of control again, that you can do something about this as long as you can manage it rather than and reverse it, rather than I think for a lot of people it's, well, I've got this and it's just this great unknown that they're living with after they realize they have heart disease.
Yeah, and I think that's one of the biggest things that from that part of it with the HeartFit Clinic, what we focus on is we give people one peace of mind and confidence.
Yeah.
And you know, we can't see everybody, unfortunately. There's a certain population of people that just want to listen to their doctor and don't want to stray from that. That's fine. But there are people, I mean, now I can take my phone out of my pocket and see what's going on right away and see what's happening with my heart health and what more can I do. Well, if people want to know what more they can do, that's what the HeartFit Clinic focuses on. And we just give more accuracy, more detail, to what your risk is of a heart attack or stroke or where your baseline is. We go into some really great testing to see where you are. And then more importantly, with some great treatment options to help you with your heart health.
And the main testing we focused on today is that pulse cardiac test.
Yeah.
So that's the 5 years that you kind of get a window into the next 5 years as to what's going on with your heart or what could happen. And then external counterpulsation or ECP. Those are the two important ones.
Absolutely, yeah.
And that you can get them right here in Calgary because you don't have to fly anymore.
Yeah, absolutely, yeah.
And it is Father's Day, so I know that for Diamond, this is also a very special day for you because your dad is a big inspiration for all of this.
Of course, yeah. And my father, he had his first heart attack at a young age, had bypass surgery at 42 years old. And, you know, he ended up with some other problems. And that's one of the reasons why I got into the field of cardiac rehab is he's my inspiration for getting into that. But really what fuels my inspiration now is to really help all these people. I mean, where my passion comes from is all the success from the patients now. And so, yeah.
I appreciate your time, Diamond.
My
Thanks
pleasure.
very much.
Yeah.
Director of the HeartFit Clinic, Diamond Fernandez. You can find his website, heartfit.ca. That's heartfit.ca. The clinic is here in Calgary. You can phone them 403-870-4348. That's 403-870-4348. You can also call them at 1-877-700-4348. And look out for Diamond's book, Beating Heart Disease. And you can read all about his thoughts and treatments and also the story of how he got into this as well. It's in Beating Heart Disease. I'm Whitney Dean. You're listening to Talk to the Experts on HeartFit on News Talk 770.